But here's the kicker. My Shark Tank companies hate selling on Amazon, but most don't have a choice. About 162 million Americans shop there. And if you want to reach them, you have to play by Amazon's rules. Amazon knows this and takes full advantage, adding and raising fees, and even launching competitive knockoffs. They get away with it because they control the marketplace and because 162 million people shop there, which makes Amazon incredibly sticky. So what does that have to do with healthcare? Insurance companies work the same way. Over 300 million Americans have some kind of coverage: commercial, ACA, Medicare, or Medicaid. Every one of those plans hires a pharmacy benefit manager or PBM to run their drug benefits. The biggest PBMs, all owned by the largest insurance companies, control pharmacy benefits for about 270 million Americans. That's a lot of power. And that's also 70% more people than Amazon reaches. Like Amazon, PBMs control the store shelves, but their shelves are called formulary, the list of drugs your insurance will cover. And if a drug isn't on the formulary, it's invisible to doctors and patients. But here's the kicker. Unlike Amazon, which wants lower prices, PBMs actually prefer higher prices. They say they negotiate lower drug costs, but they don't. They auction off access to their formularies to the highest bidders. Drug companies pay the rebates and fees PBMs demand so their drugs can be covered and prescribed. If they don't pay, they lose access to millions of patients and plenty of doctors, costing them billions. Patients are getting ripped off because PBMs and wholesalers insist on using inflated list prices instead of transparent net prices. Because the whole system is built around list prices, everyone, PBMs, wholesalers, and insurers, have an incentive to keep prices rising, and they almost always do. If manufacturers, wholesalers, and payers move to net pricing, meaning the price after all rebate and fees, patients' out-of-pocket costs could drop by half overnight, saving patients billions every year. So what do? 1, count all cash payments towards deductibles. 2, base patient out-of-pocket costs on net price, not list price. 3, separate formularies from PBMs to end their power. Fix that, and we finally put patients, not PBMs, back at the center of American healthcare.